So I'm doing my presentation on the eating disorder bulimia nervosa. And bulimia nervosa is a potentially life-threatening eating disorder in which a person goes through cycles of binging and resorts to self-inducing behaviors such as vomiting, laxatives, enemas, just to undo the previous binging. Okay, so in this presentation I'm going to tell you about some symptoms of bulimia, theories for the disorder, the prevalence, consequences, and treatments for this disorder, okay? So we're going to get started. I'm going to start talking about the symptoms of bulimia nervosa, and some of the symptoms include going to the bathroom right after meals, smelling like vomit constantly, having swollen cheeks or just a swollen face, excessive exercising and dieting, having discolored teeth, when a person has calluses on their fingers and knuckles from throwing up so much, and when a person has no control over what they eat, or how much or how little they eat. These symptoms I just listed are some of the most common symptoms in a person with bulimia nervosa. In this next section, I'm going to talk about the prevalence of bulimia nervosa, and I'm going to talk about the lifetime prevalence and the 12-month prevalence, according to some studies from the DSM-4. The lifetime prevalence for males is 0.5%, and in females it is 1.5%, with a total bringing it to 1.0%. 12-month prevalence for males is 0.1%, and in females it's 0.5%, with a total of 0.3%. You can see that it is mostly seen in women, and a few men that develop the eating disorder are either gay or bisexual. You can see there's a big gender difference in bulimia nervosa, as in males, there are quite few males that get the disorder. Age is also a difference here. The age of onset ranges from about 18 to 21 years and is most likely to develop in adolescent women. Next, we're going to talk about some theories that can cause these eating disorders. There are biological, psychological, and social factors that contribute to the development of bulimia nervosa. We're going to start talking about the social theory. The media pressures young, especially adolescent women, to portray a certain body image that everyone must comply to. They see that certain body image to present happiness and success, which is not often the case. There are also family pressures in which your family is constantly telling you you look too big, telling you you need to be thinner, and that plays a big part of it because as your family, it takes a big toll on you. From the biological standpoint, there is a possible genetic link that is thought to cause bulimia nervosa. For example, relatives of someone with bulimia nervosa are 4 to 5 times more likely to develop it themselves. They are still unclear as to what is inherited that causes it. They believe there is a possible genetic link. The psychological theory suggests that perfectionism and low self-esteem are a big cause of bulimia nervosa. For example, low self-esteem or someone who has an anxiety disorder are most likely to develop an eating disorder such as bulimia. There are people who are very stressful and worry too much about their weight. Now, perfectionism, a person who is a perfectionist is always striving to be perfect, and to them the perfect body image is a goal. So they lean towards a perfect diet, strict eating habits to get to a certain weight and stay that way. With bulimia nervosa, there are many consequences to all these purging techniques. And people with bulimia nervosa tend to compensate for the binge eating and potential weight gain almost always by purging techniques such as vomiting, laxatives, enemas, and diuretics. They don't realize how much the consequences can affect their daily lives and how long they affect their lives. Some of the consequences include, vomiting causes dehydration. Dehydration can also cause electrolyte imbalance, in which your sodium and potassium levels are imbalanced, which causes cardiac arrhythmia, in which your heart begins to skip heartbeats. You can also have seizures and kidney failure in the future. Now, laxatives, they can cause severe cases of constipation and also lead to colon damage. Extreme vomiting can also cause a rupture in your esophagus, and vomiting also causes a salivary gland enlargement, which swells your cheeks from the inside and makes them big. Your hands also begin to have calluses and scabs from all the times that your fingers touch your teeth or you're trying to stick them into vomit. Another consequence is you can have discolored teeth from all the stomach acids from the throw up, and it begins to kill all the enamel in your teeth. These are pretty big consequences that you have to deal with for the rest of your life. Although there is no cure for bulimia nervosa, it is treatable by a medical professional. Now, treatment is very important for this disorder because it can be very dangerous if not treated. There are a few forms of treatment such as biological, cognitive behavioral treatment, and interpersonal psychotherapy. Now, psychotherapy is a type of treatment that uses counseling or talk therapy to discuss your bulimia and related issues. The cognitive behavioral therapy helps identify negative behaviors and replaces them with positive ones. In the first stage, it talks about physical consequences and ineffectiveness, and later stages work on altering dysfunctional thoughts and some coping strategies. Some drug treatments include using Prozac as a most effective for bulimia. And most drugs that are antidepressants that work with eating disorders also are effective for anxiety disorders or mood disorders. Most of the time, cognitive behavioral treatment is paired with any drug treatment, but severe forms of bulimia with health complications may need treatments in hospitals or rehabs. And that is it for this presentation. Lastly, I know dietitians can also help people with bulimia by developing eating plans, and that achieves a healthy weight and obtains good healthy eating habits. Bulimia is an eating disorder that can be dangerous and life-threatening, but it is treatable, and it can get severe and provide a lot of lifetime consequences if not treated. It's not a disorder that'll go away, its symptoms won't go away forever, but it is something that someone would have to work on for the rest of their lives. There are many symptoms, but there are also treatments that can help and coping mechanisms that medical professionals can help with. Now that we know a lot more about bulimia nervosa, we can go ahead and help others who need it.